Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. If you'll remember, last week we started our discussion of functional medicine. We talked about what it is and how it's different from conventional Western, quote-unquote, medicine. We discussed that the main focus of functional medicine is the treating of the entire body of the patient, not just a specific portion or what you feel is going on right now. We talked about how functional medicine stresses that the cause of disease isn't necessarily just one thing, but involves maybe a cascade of events resulting in the symptom or set of symptoms that are then labeled as a specific disease. We used the example of a tree to describe this focus and difference, mainly because I could relate to that. For the sake of reminding everyone of this, Doc, can you do a quick summary for us of that example?
Sure. You know, if you see a tree and that tree has, sick-looking leaves or branches, would you just treat the leaves or the branches?
I hope not.
Well, of course not. No, you would evaluate the soil and the roots to see what's going on and what's wrong there, and then treat that. Now, you may also treat the leaves and branches, but if you don't treat the roots and the soil, the tree isn't going to have much chance of getting any better.
Okay, let's continue with that thread. We also described several differences between conventional Western medicine and functional medicine. Firstly, conventional Western medicine looks for a symptom or symptoms and applies a drug or surgical therapy or remedy, where functional medicine will look for a causative issue that may be local or distant from the symptom that the patient's expressing. Secondly, conventional medicine is very specialized, where functional medicine is holistic in its approach. Thirdly, functional medicine is more patient interactive. In functional medicine, the patient takes on a greater role, thus a greater responsibility in their own recovery in conjunction with their doctor's advice. Another thing we mentioned as a difference is that conventional medicine is best when applied to acute or traumatic conditions or situations, of course, whereas functional medicine stands out in treating the more chronic conditions and diseases. And finally, research has shown that functional medicine is more cost-effective because it tends to stress prevention and wellness more than you'll typically find with conventional Western medicine. Aren't you glad I took good notes? This week, we want to be a bit more specific about the functional medicine approach to restoring health and vitality. Doc, is there a basic or maybe primary starting point when looking at a patient's situation from a functional medicine point of view? I'm wondering, where do you start?
A lot, Laura. Depends on the patient's condition.
Of course, yeah.
However, I think most, if not all, functional medicine practitioners would agree that a central area that requires initial investigation with patients with a chronic condition is their digestive system, or the GI system, GI standing for gastrointestinal.
Thank you. You knew I was going to ask about that.
Yeah, I figured you would. Here are some interesting facts about the GI tract for your edification. The GI tract is about 9 meters long, running from the esophagus to the anus.
Whoa. 9 meters?
9 meters.
That's 30 feet.
30 feet, exactly.
Oh, I'd be a lot taller if I could stretch all that out.
Yeah, maybe you could reach that top shelf or that top cabinet at home.
All right, smarty britches. I think it's time to move on. Tell us some more.
Yeah, another interesting thing about the GI tract is if you could lay it out to figure out how much surface area there is in the GI tract, if you could lay it all out, it would cover an area about the size of a regulation tennis court. That's
Holy
a lot
cow.
of space, a lot of space.
So what are we talking about here? From your mouth, you're talking about the inside of your mouth, your esophagus, your stomach,
Small intestine, large intestine, until it goes out, right?
Wow.
Another
Okay.
interesting point, and I think this is the one that maybe is a little bit more important, the GI tract has a very complex and sophisticated neurologic system associated with it. It contains some 100 million neurons or nerves, more than either the spinal cord or the peripheral nervous system.
That's huge.
That's a lot of nerves. This multitude of nerves then allows us to feel our inner world. A lot of the neurological firepower is applied to digesting our food. Breaking down the food and moving the food along the canal until it is excreted out. Because we have this large neurological network, the GI tract can act independently of our brain. We don't have to tell our gut to digest the food. It just happens. I mean, could you imagine having to sit there and think about digesting your food and then excreting it? I mean, think about a nice turkey dinner. Laura, you make a great, great Thanksgiving dinner.
Well, thank you.
Could you imagine having to think about digesting that food and passing it along your system?
Boy, that
and
would keep you busy.
That's right. It would keep you busy and occupy your brain. But fortunately for us, our digestive system does it automatically. And one more thing about this large neurological network. There is a main branch of this network that's called the vagus nerve. Now, there are many nerves that make up this network, but the main one is called the vagus nerve. And for those of you that have some knowledge of anatomy, it's also the 10th cranial nerve. But interestingly enough, this nerve carries information more to the brain. In other words, about 90% of the fibers in the vagus nerve carry information from the gut to the brain, not the other way around.
Interesting.
With all that information going to the brain from the gut, something else must be at play here besides or in addition to digestion. But we're going to talk a little bit more about that later in the program.
Wow, I didn't realize that the GI tract was so complex. I suppose we all know that it is, but we just never stop to think about it. What happens to that piece of food after you put it in your mouth? It's kind of odd to think it has more nerves than the spinal cord or the peripheral nervous system. It's almost like it's a second brain.
Well, it's ironic that you say it that way, Laura.
Why?
Because many researchers and practitioners think of it in exactly that way.
Oh, yay me!
Our GI tract is a second brain. Research has demonstrated convincingly that our GI tract can be a major player in depression.
Really?
Some 30 neurotransmitters are used by our GI tract, just like in the brain.
Wait a minute. Neurotransmitters. There's another doctor speak word. What exactly are those, Doc? Can you define that for us?
Another one of those words, huh?
Uh-huh.
Neurotransmitters are chemicals that the nervous system uses to transmit nerve impulses or messages from one nerve to another nerve or from a nerve to a muscle. These neurotransmitters can also inhibit the transmission of nerve impulses as well. So it's not just the transmission, but maybe even the inhibition of the transmission of nerve impulses.
Okay, you can go on now.
Okay. Like I said, the GI tract uses some 30 neurotransmitters, just like our brain. As a matter of fact, one major neurotransmitter called serotonin is predominantly manufactured in the gut. Some 90% of all the serotonin in our body is made and found in the GI tract.
Wait a minute. I thought serotonin was produced in our brain, like the one above our shoulders.
Well, there is some certainly produced there, but it is also produced in the GI tract. And as a matter of fact, there is more produced in the GI tract than there is in the brain above our shoulders.
Never heard that.
I told you that I would get to other functions of the GI tract later in the program. Well, here's one. Research has shown that the mood we're in is partially controlled by our GI tract. A classic example is having butterflies in your stomach. You know that feeling you get in the pit of your gut when you're anxious or nervous about something? They're discovering that maybe even our everyday emotional well-being may be more dependent on our gut than we realize.
Really? That is interesting. I'm a little familiar with those butterflies. See, I remember when you and I got married a few years ago. Woo! Ooh, what butterflies, but unnecessary ones.
I remember that very well.
Does the GI tract play into any other functions in our body besides digestion and emotional well-being or moods?
Yeah, it does. It does. One more interesting bit of information about our GI tract is that 70 to 80% of our immune system is directly related to the GI tract. Just think about it. Where is one of the first contacts our body has with environmental toxins and pathogens? It's the digestive system.
Right, right.
So it's no wonder that the immune system is so intimately involved with it. This functionality of the gut's immunity is a major player or component of the functional medicine practitioner's evaluation of patients with chronic condition. The question being asked is, how is the gut influencing the patient's immunity and thus their health?
Okay, let's ask that question then. How or maybe why does the GI tract play such a major role in a patient's health? I would think that most people think if they have a problem with their stomach or their bowels, it would be limited to those specific areas, but you seem to imply that isn't true. Problems in these areas can affect other areas too?
Absolutely. Now, it is true that sometimes patients have problems with their stomach or their bowels, and that it's those specific areas that are problematic. However, sometimes when patients have problems with their stomach or bowels, that's an indication that there would be a problem somewhere else, and it can affect their health and vitality of the entire body. So, absolutely, it can affect other areas too. To understand, let me explain a well-researched and documented situation that occurs in the GI tract in patients who have chronic disease. To further understand this, it's important to know how the normal bowel functions as it relates to immunity. When we eat food, the healthy, normal bowel will allow the passage of the nutrients and other things that our body needs through the lining of the intestinal wall to be absorbed then by the bloodstream to be taken to the specific areas of the body where it would be needed. That function is called permeability, and there is a certain amount of permeability that's allowed in our digestive system that would be considered normal. The problem arises then when that permeability is altered. The things that might alter this permeability would be things such as severe infection, but more commonly it would be food sensitivities or food allergies. And a lot of times patients don't know that they're sensitive to foods. Now they can have the severe allergy, and I'm sure we're all familiar with that, but in the digestive system, even foods that are just create sensitivity for us, can create an altered permeability of the lining of the intestine so that now the intestine is no longer able to keep out the negative things that would cause our body harm. This is called increased permeability. Another name for this, a layman's term, would be leaky gut.
Thank you. I was going to have to ask you the doctor speak question again.
Okay, well, I'm glad I clarified that.
Thank you.
A simple way of understanding this is to understand the term leaky gut, and that's exactly what happens. The gut becomes leaky to things that are not supposed to pass through from the inside of your intestines to the bloodstream.
So, Doc, if you are talking about food allergies, and sometimes there's a food allergy that we may not even know we have that could be causing leaky gut, how do you know? How do you find that out? I mean, we've all heard of people who, now gluten intolerance is a big thing, but not all of us have gluten intolerance, and maybe more people than we realize. Could that be one of those things? You don't realize your tolerance level is altered?
Certainly with food sensitivity, you are absolutely right. You probably aren't even aware that you have food sensitivity. How many times do we eat a dinner and maybe have just that touch of gas upset or just a minor change in the character of our bowel movement? Those are things that could indicate that you're sensitive to something that you ate, but not necessarily allergic to it. Certainly the idea of gluten intolerance is a major player today and certainly alters the permeability of the lining of the intestine, and that would be a huge leaky gut indicator, of course. But how do you know that these things occur? It's most commonly done by a stool sample laboratory test.
I see. Okay. Well, and I mentioned gluten intolerance because that's the hot topic now.
Absolutely.
That, everyone hears about.
But how does leaky gut then influence the immune system, and then how does that result in chronic disease? Well, how much time do you have?
Yeah.
But what I'll try and do is give a quick synopsis of how that plays out. When these harmful things are allowed to pass through the intestinal wall and be absorbed by the body, it fires up the immune system because the immune system recognizes these things as foreign invaders. This upregulation of the immune system then results in a chronic inflammatory response. Now, we're all familiar with an inflammatory response, like when you damage a joint, like you did on your wrist working in the yard yesterday, where there's swelling and there's pain, and it's obvious that the joint is injured, and it's obvious that the joint is inflamed. But in a chronic inflammatory process situation, the patient may not even know that it's occurring. There is no outward signs of chronic inflammation until a disease state has exhibited it itself. Some classic examples of this would be heart disease, type 2 diabetes, or autoimmune disease like multiple sclerosis, rheumatoid arthritis, or Sjogren's disease. I mentioned Sjogren's disease because it clearly demonstrates the difference in approach from functional medicine versus conventional medicine. I'm going to read a definition of it from the Mayo Clinic on the internet. Although you can develop Sjogren's disease at any age, most people are older than 40 at the time of diagnosis. The condition is much more common in women, and treatment focuses on relieving symptoms. That's a direct quote from the Mayo Clinic. There's nothing there about trying to find the cause of the autoimmune response in the body. It's just a matter of let's treat the symptoms. A classic example of the difference between conventional Western medicine and functional medicine.
So, Doc, a major culprit in patients who have chronic disease is the creation of chronic inflammation, commonly caused by leaky gut, in the patient, right?
Exactly. I'm glad I got through to you.
Yeah, that was a lot of information to process.
Okay, let's get back to chronic inflammation. More and more research is showing that chronic inflammation is the problem with most patients who have chronic disease issues. The classic example, and I mentioned this earlier, is heart disease. The current model that's accepted by most healthcare practitioners today is that heart disease is caused by high cholesterol that's then creating atherosclerotic disease. Interestingly enough, research is showing that that's not necessarily true, that in fact it's chronic inflammation that's creating the atherosclerotic disease process and not the high cholesterol. If there are any medical doctors listening out there, I'm sure they're probably thinking that I'm nuts by now. But it's interesting to note that the original idea of high cholesterol / high fat diet creating heart disease was created by Ansel Keys starting back in 1947. And then again, he did his research in 1956. That resulted then in the current theory of cholesterol and fat creating heart disease. Well, I'm here to tell you that I think research is bearing out that really isn't the way things work, that in fact it's chronic inflammation that's resulting in the generation of heart disease. So the idea that you need to take a statin to lower your cholesterol could really come into question here as they show more and more convincingly that high cholesterol isn't really the issue. Now listen, I'm not advocating that anyone stop taking the medications as prescribed by their medical physician, but I do think that there is enough of a debate here that you should be able to talk with your medical physician about the viability and the efficacy of taking a certain medication when it may not be the treatment required to help you with the condition that you're dealing with. If you're interested in reading more about this debate, I'd suggest that you Google this on the internet. There are a number of websites available for people to read and to peruse that discuss this very issue. So don't hesitate to do your own research to come to your own conclusions about this topic. But once again, let me be clear. I am not here to come between you and your medical doctor. You need to follow their advice. I am here, though, to tell you that I think it would be prudent on your behalf to talk with your doctor about this very issue if you have concerns about it.
Okay, I get it, and I hope our listeners do too. Are you saying that this leaky gut situation is the cause of heart disease?
To say that it's the only cause is wrong.
Okay.
There are other factors involved, things like lifestyle and genetics. However, it's a place to start, and in my opinion, the most important place to start. I will go as far as to say that all of the patients with chronic disease, most if not all of them, will have some type of GI tract disturbance, whether it's leaky gut or some other more symptomatic GI tract issue like IBS or Crohn's disease.
That's irritable bowel syndrome?
Yes, that's correct.
Well, how then does a functional medicine practitioner diagnose this leaky gut problem?
Well, you asked me that question a little earlier, and so let me repeat the answer. That's done relatively easily by doing a stool test.
That's right.
The stool test, it's a simple test. People can do it at home at their own convenience, and when they've completed the test, they mail it to the laboratory, who then analyzes it for specific things and then sends the results back to the provider.
That sounds fairly simple.
Yes, it is. It's very easy to do.
Okay, interesting. Can we continue this discussion again next week, Doc? I think we may be running short of time, and we don't want to shortchange anybody, but maybe we can talk about other testing procedures that a functional medicine practitioner might perform. I know I've done several of them.
Yes, you have. And absolutely. Like I said last week, I hope to spend the next couple of shows on this topic and eventually tie it all together to show how a functional medicine practitioner is well suited to handle chronic disease conditions. But one more thing before we end. Chronic disease is a food and lifestyle-driven, environment and genetics-influenced phenomenon. New approaches to management and prevention are required, like looking at the GI tract, if we are to slow the rising tide of chronic disease. However, this rise in chronic disease that we're talking about can be conquered if we integrate what we know about how the human body works with an individualized, patient-centered, scientifically based treatment plan that addresses the underlying cause of chronic disease, which I said earlier are rooted in lifestyle choices, environmental exposures, and genetic influences. This is exactly what functional medicine does, and is indeed a medicine appropriate for the challenges of the 21st century.
Thanks, Doc. That was really informative and interesting continuation of our discussion last week, and I hope we'll hear a little more about that. Now it's time to move on to the tip of the week. I think we're running low on time and we want to get that one in. It's very interesting.
Okay, yes, since we're talking about the GI tract, let's give a tip that relates to that. How many of us have developed that dreaded diarrhea after eating something that was spoiled or not cooked properly?
Well, you remember those.
Most of us, I'm sure.
Yeah.
Well, research has shown that people who take probiotics as treatment for diarrhea have the number of days they suffer shortened significantly versus those who didn't take the probiotics. The probiotics tested in the studies were taken in various forms, such as yogurts, taken in milk, special baby formulas, powders, or capsules. And the most commonly tested probiotics were Lactobacillus casei, Saccharomyces boulardii, and Enterococcus bacteria. So the next time you have that issue, reach for the probiotics.
Okay, Doc, hang on a second. Are these the most common bacteria that you'll find in things like yogurts and in bottles that you can just buy from off the shelf in grocery stores, or do you have to look for something special?
Now, most commonly they are found in the things that you'll buy off the grocery store shelves, but you might want to take a look and make sure. Those are the most common kind, and they are the most effective kind according to the research.
Okay, thanks. Well, that about wraps it up for another edition of the Chiropractic Corner. Again, thank you for joining us and for all of your input. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at M as in Mary, CHIRO, the number 1, at gmail.com, or by calling our office at 746-4242. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office or to listen to archived programs from the Chiropractic Corner. And coming soon, our show bloopers. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about healthcare and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner, right here on WJUP, The Jupe, 103.9 FM, Saturday and Sunday mornings right after the 10:30 a.m. news. Until then, be well, live well. We'll see you next week.